SIADH. Various causes of SIADH. SIADH means it's syndrome of inappropriate ADH secretion. That means ADH secretion is happening even there is low plasma osmolality. If there is low plasma osmolality, then your ADH should not act, but still the ADH is secreted, and that is causing SIADH. Understood? Now please do remember this SIADH is a cause of euvolemic hyponatremia. Okay. Now why there is euvolemic hyponatremia and why there is hyponatremia? Okay. So please understand here. I told you there is, though low plasma osmolality is there, but still there is ADH secretion happening. But because of this ADH secretion, guys, what happens? It will cause antidiuresis. Antidiuresis will happen. Now because of antidiuresis, what will happen? Water will be reabsorbed into the body, so it will increase the intravascular volume. So basically it will cause loading of the water inside into your vessels, into a systemic circulation, leading to intravascular volume overload. Now because of the increase in the intravascular volume, okay, what will happen? There will be baroreceptor stimulation. Now as your baroreceptor is stimulated, there will be atrial natriuretic peptide which will be liberated, and because of this atrial natriuretic polypeptide, what will happen? There will be loss of water, that is H2O, and there will be loss of sodium through the urine. Now you understand there is increased volume of water inside the vessel, so intravascular volume was increased, but because of that there is loss of water happening, and that makes the euvolemic state. So ultimately there will be euvolemic state. And also you understand that there is loss of sodium happening, and this loss of sodium is going to cause hyponatremia. Okay, so that is the main funda here. Please do remember this loss of sodium that is happening, it is more than equals to 20 milliequivalent per liter. More than equals to 20 milliequivalent per liter, it is the cause. And SIADH diagnosis is made on the basis of things like you should not have other causes of hyponatremia. You have to rule out the causes of hypovolemic hyponatremia, hypervolemic hyponatremia. Then you have to come to the diagnosis of euvolemic hyponatremia, and then the diagnosis of SIADH. So what are the causes of SIADH? Let us discuss that. First cause, you have to know that many carcinomas are the causes. So carcinoma, like you have lung carcinoma like small cell carcinoma or oat cell carcinoma, duodenum carcinoma, okay, then you have pancreatic carcinoma, ovarian carcinoma, and bladder and ureter carcinoma. So bladder, so here lots of carcinomas are there, they can lead to SIADH, but most important here you have to remember lung carcinoma, small cell carcinoma, or oat cell carcinoma. Okay, that's question. Next, coming into other malignancies like what are the other malignancies I'm talking about? Yes, Number 1 is thymoma. Very important question are asked. Thymoma is a question. Next is mesothelioma. Mesothelioma. Next, bronchial carcinoma. Very important. Bronchial carcinoma. Bronchial adenoma, not carcinoma. Bronchial adenoma. Next is carcinoid. Very important. Carcinoid. That's a question. Next is gangliocytoma. Gangliocytoma. And next is Ewing sarcoma. Ewing sarcoma. That's a question. So these are all questions. Okay. So carcinoma, lots of carcinoma are there. This is very important. Next, you also have to remember certain neurological causes are also there. Certain neurological causes are also there, like Guillain-Barré syndrome, like multiple sclerosis. That's a question. Like amyotrophic lateral sclerosis can cause, hydrocephalus can cause. Okay, these are very important causes. Next set of causes are certain drugs. The drugs include itself the desmopressin or vasopressin. Desmopressin or vasopressin. Next is oxytocin. Next is vincristine. Vincristine. Next is nicotine. Okay, and you have monoamino oxidase inhibitor, or you have TCA. These are also there. You can also remember carbamazepine. Carbamazepine. Okay, this is the question. So there are many causes are also there, like infections are also there, TB, pneumonia, abscess, meningitis, AIDS, encephalitis, and vascular causes are also there. Okay, vascular causes are also there. You have cerebrovascular accident, or you have cavernous sinus thrombosis. Okay, one important cause I forgot to mention is metabolic cause, and this metabolic cause is acute intermittent porphyria. So acute intermittent porphyria. So if you want to remember one thing, remember AIP, acute intermittent porphyria. Remember small cell carcinoma, oat cell carcinoma. Remember thymoma, bronchial adenoma, carcinoid, and Ewing sarcoma. Here remember multiple sclerosis, and here remember vincristine, nicotine, and carbamazepine. These are the drugs which will cause SIADH.